Dr. Isha Sharma, Head and Director Psychiatry, Chandan Hospital, Lucknow. 24th May is World Schizophrenia Day. I'll share some facts about schizophrenia. Schizophrenia is a chronic, severe mental illness. It affects 1 in 100 people, more common than we think. It affects males slightly more commonly than females. The age of onset in males is the late teens or the early 20s, while in females it is the late 20s or the early 30s. Schizophrenia generally affects thinking, perception, language, behavior, emotions, and sense of self. The common etiological factors that are incriminated in schizophrenia may be genetic factors, environmental factors, neurotransmitter or chemical changes in the brain, and sometimes substance abuse. Being a chronic illness, the patients who are suffering from schizophrenia generally face discrimination, stigma, and violation of human rights. So it is pertinent that awareness, early diagnosis, and treatment is required. The symptoms of schizophrenia may be hallucinations, hearing voices, seeing things, smelling things, or feeling touches which other people cannot, and these seem very real to the patients. Delusions, firm, fixed, false beliefs which cannot be changed. For example, patients with schizophrenia feel that somebody is out there to kill us, there's a conspiracy going on against us, somebody is poisoning our food, some chip has been planted in our body or brain which is trying to control us, or we are on a special mission, or we have some special powers. Cognitive symptoms, which includes disturbance in attention and concentration and memory. Negative symptoms, lack of emotional responsiveness, motivation, interest in relationships, or a world and life in general. Disorganized thinking and disorganized behavior. Disorganized thinking is manifested as disorganized speech, difficulty in organizing thoughts, ineffective communication, strange or new words. Disorganized behavior may be abnormal long postures, childlike silliness, sometimes abrupt agitation. The initial symptoms or the prodromal phase may have symptoms which are different from the full-fledged symptoms, generally affecting the teenagers. These symptoms may be withdrawal from friends and family, hostility, suspiciousness, irritability, depressive symptoms, change in sleeping patterns, poor performance in school, different patterns of grooming and dressing, use of strange or inappropriate words. These may be the early signs of schizophrenia. The myths associated with schizophrenia. First is that it is a multiple personality or a split personality disorder. A split personality disorder is a different diagnosis and is far less common than schizophrenia. Schizophrenia cannot be treated. This is a myth. Although no cure is available, but schizophrenia can be treated, symptoms can be controlled, patients can lead a productive life. Every time a hospitalization is not required, sometimes when there is exaggeration of symptoms, hospitalization may be required. The patients with schizophrenia are violent or dangerous. Sometimes the patients may become violent, but all the patients are not violent, and all the times patient cannot be violent. So early diagnosis and treatment is important and crucial, so that at the right time when treatment is instituted, a better life is promised to a patient, the symptoms are controlled, complications are reduced, and a better outlook for the future. With new drugs and new researches coming up, we can help patients who are suffering from schizophrenia. So on this Schizophrenia Day, we promise ourselves that we would support people who are suffering from schizophrenia with new hope and respect, and help them lead a better life. Thank you.